Hello, everyone. This is Ferris da Silva from Silva Languages, and today's psychology podcast will be on rumination. We will talk a little bit about the meaning of the word and also different ways of dealing with it. So let's get started. The first question that comes to mind is, what is rumination or thought rumination? Rumination occurs when you have constant and repetitive thoughts about something, typically a problem or a situation. You might have experienced excessive rumination when you try to go to sleep one night and you had a lot of negative thoughts going through your mind. They could have been about a situation that kept you from sleeping, could have been about work, family. The examples are endless. These thoughts become hard to let go because they tend to repeat themselves in our heads over and over and over. And the end result is that they cause us to feel anxious, upset, or even depressed. But let me be a little technical here. Let's talk about our default mode network. Research shows that the default mode network, or DMN, is very active during periods of self directed thought or introspection, and the dysfunction of the same may contribute to rumination and self preoccupation. This is true especially in patients with major depressive disorder. The default mode network is less activated when we're focusing on the task at hand and need to use our cognitive skills. In the longitudinal research, those who had family members pass away from illnesses showed that those who ruminated over the course of 18 months were more likely to become severely depressed than those who didn't. Let's move away from the technicality of the topic for now, because I want to focus on some examples of rumination that take place in our minds from time to time. The question here is, when does rumination become a problem? It can become harmful and affect you when you spend an overwhelming amount of time on it, and when it heightens or increases your distress. Remember that we all have stressors in life. No one is immune to that. They can range from daily hassles, as waiting in line at the supermarket, being stuck in traffic, to major life events such as the death of a family member, moving, getting married, or even going to college. You may be experiencing excessive rumination if you're feeling some or all of these symptoms. Constantly feeling fatigued, overwhelmed, and tired, muscle tension or pain, increased heart rate, rapid breathing, shortness of breath, sweating, trembling, shaking, and digestive issue, among others. Now, you may be asking yourself, how do I stop it? Practice mindfulness. Simple things like paying attention to the here and now keeps your mind present and free of repetitive preoccupations. One final piece of advice is for you to schedule your anxiety. What does that mean? Give yourself a few minutes to worry and ruminate. When the time is up, make yourself move on. If after trying all these things that we talked about today, you still feel that you need some extra help, talking to a therapist will be a great way to address those issues. Good luck, and thank you for joining us today. Follow us for more.